Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today we're taking a closer look at that new Congressional Budget Office report on the American Health Care Act. Now, this is the American Health Care Act that was passed by the U.S. House of Representatives on May 4th. It's not the final version of the bill. It still has to go to the U.S. Senate. Traditionally, the House would wait for this report, wait for this Congressional Budget Office report before they vote, because this report's going to give a cost estimate and an impact analysis of the legislation that is in front of them. The House went ahead and voted early. They just wanted to make their political statement, and then the CBO finally caught up and said, okay, we finally got this report together. This is what they announced on May 24th, that the impact of the American Health Care Act is going to be huge on patients, on low-income consumers, and those with disabilities. And we'll look at the numbers in just a second. But let's refresh our memory that this is actually the second Congressional Budget Office report on the American Health Care Act. They had a report prepared in time for the vote that was supposed to happen on March 23rd. That never came to fruition. The House never voted at the end of March. They didn't think they had enough votes to get this bill passed. They made several amendments, the Palmer Amendment, the Upton Amendment, the MacArthur Amendment, to change provisions of the way private insurance was delivered and some of the flexibility given to states. Once those amendments were introduced into the bill, that's the version that passed the House. So the Congressional Budget Office had to start over and do a whole new analysis with what that final version looked like. That's what we were waiting for, and that's what came out of the CBO on May 24th. Let's take a look at some of the impact of what the CBO found. They said this House American Health Care Act bill will, first of all, increase the number of uninsured. Plain and simple, they said by the year 2026, there will be 51 million people uninsured. Most of that is because the American Health Care Act will make 23 million additional people lose their health insurance in the next 10 years. The impact of this bill alone will mean that an additional 23 million people will lose insurance over the number that might have otherwise been insured under the current law. It also said that's going to have the biggest impact with those people ages 50 to 64, a little bit older, that are falling under 200% of the federal poverty level. In some instances, these people are going to see that their health insurance premiums are going to raise 300%. The impact on this group itself is going to be huge. They're a little bit lower income and they're a little bit older. The American Health Care Act that passed the House did bring back age rating of insurance plans. So older folks and folks with disabling conditions are going to be hit the hardest. They predict that not only are their premiums going to go up, but because their insurance will become at a point unaffordable, they will become the new class of uninsured. The cost estimate is pretty dramatic. They said that this is going to lower the federal Medicaid spending by $800 billion over the next 10 years and reduce the number of people on Medicaid by about, and they estimate 14 million, and that's just over the next 10 years. That's about a 17% decrease in our Medicaid population. A lot of those folks are Medicaid expansion folks. In other states that expanded Medicaid, they're going to see that Medicaid expansion will go away, and those will be the people reduced from the roster of Medicaid. But it also includes the people in states where the state might elect to block grant Medicaid or do the per capita cap option for Medicaid. That in itself would limit the enrollment in Medicaid for those states, and that contributes to that 14 million number. I would actually project that that number is going to actually be much higher when we actually see that the funding looks like going to Medicaid for states in their block grant or per capita cap, depending on which states change. That was the other flexibility written into the American Health Care Act in time for that May 4th vote, was giving a little bit more flexibility to states to not just do a per capita cap in Medicaid, but also consider if they want to do a block grant. Other CBO findings. Now, you might remember from the original Congressional Budget Office projections that there would be a deficit reduction of a couple $100 million. Well, after the amendments were added, that deficit reduction actually went down. It's now $119 billion in the next 10 years. So we're cutting people off of the programs, and we're not reducing the deficit as much as we thought we would with this bill. And a lot of folks are reacting quite negatively to that impact, that you're not even saving as much money as you thought you would. The money that is saved, the $200 billion additional saved over the next 10 years by getting rid of the Affordable Care Act and replacing it with the American Health Care Act, would mostly come from replacing the Affordable Care Act subsidies, those premium and cost-sharing subsidies, with things that are more age-based premium tax credits. That's where most of the $200 billion is being made up. Also, the savings comes from reducing spending from about $665 billion to about $375 billion, cutting our reduced spending in about half. Now, what else is the CBO telling us? Well, we know from the version of the American Health Care Act that was passed that states would be able to seek waivers from things that were mandated under the Affordable Care Act, like providing all 10 essential health benefits. The CBO gave their projection of what that would do to the general population if states did accept waivers. They predict that about the states where about half of the U.S. population lives would be those states that would go ahead and elect to offer those waivers from essential health benefits and would bring back some sort of pre-existing condition exclusion into their plans. They said in their prediction they would go as much as to say that many states would opt for the full waiver. Go ahead and bring back pre-existing condition discrimination and go ahead and seek a waiver from essential health benefits, and that's going to impact 1/6 of the states that are out there. They then say not only is this going to impact people by giving them less insurance and charging them more for it, but it's going to cause by 2026 unheard of market instability, which is the biggest irony of the whole package. The whole American Health Care Act was passed under the guise of building stability into the insurance marketplace. And the very first finding that the CBO offers us is saying, no, what you're actually doing is going to build market instability by 2026. Now, there are going to be places where premiums will actually go down. That was part of the prediction. And the CBO clarifies, well, this is probably going to be based on the fact that people that are sicker are just going to choose not to buy insurance. So then you will see that the marketplace itself is a little bit healthier and premiums might actually decrease. There are states that are already considering opting for some of these waivers. What a waiver from essential health benefits could do, for example, is allow a state to say, yeah, I want to offer newborn screening as an essential health benefit, but I don't want to offer maternity coverage. Under this version of the bill, that would be totally allowed. Some other CBO findings. There would be a sharp increase in premiums, like we talked about before, for older, low-income folks because they are bringing things back like age rating in the marketplace. There'd be substantial increase in out-of-pocket costs for people in states that did elect some of those waivers. Even though we just talked about some premiums going down because you have a healthier marketplace, the CBO is projecting even in those markets where premiums go down, the patient responsibility and cost sharing will go up. There'll be more out-of-pocket costs even though premiums might be coming under control in some of those states. Finally, once again, they do emphasize, and they talk about this throughout the report, that they will be states that will be cutting essential health benefits particularly, and they call out 3 areas where they foresee that states will cut benefits: maternity coverage, mental health, and substance abuse services. Totally contrary to the point of a lot of legislation, especially right now in Wisconsin, where we're trying to tackle substance abuse and mental and behavioral health treatment for people such as those in part of our opioid epidemic. This runs completely counter to that, giving states the flexibility to say, we're not going to offer any mental health services at all. You can read the new CBO report in its entirety. It's about 40 pages. They also offer a summary on their website, and we give you the link to that page as well. There's also been extensive media coverage, as you can imagine, about this new CBO report, mostly because it was so hotly anticipated, because the House did vote on it prematurely. So you can read some of the media report. We share with you the modern healthcare version, which actually calls out what they call their top 15 findings of the CBO report, things that are most damning to the American Health Care Act that come out of the Congressional Budget Office. Of course, you can also visit our information button to see these links or to share your healthcare story or to send us an email at healthwatchwisconsin.org. Thanks for joining us.